is Michael I'm a veterinarian here at Animal Kingdom. Today I'd like to talk to you about dental care for our pets, mostly dogs and cats, but technically this would involve all mammals. As mammals, we're going to get infection in our mouths. It's guaranteed, it's going to happen. That's why we brush our teeth twice a day. If we do a good job, we still have to occasionally go see the dentist, and we're going to survive that visit. I mean, it's going to be uncomfortable, could be expensive, but we're walking out of there. Now that's where our pets vary from us. Yes, they're going to get the same kind of infection in their mouths like us, but when they go to the dentist, that involves general anesthesia. Well, I can't promise my pet's going to survive a dental, and I can't promise you that your pet's going to survive a dental. I don't want to clean my pet's teeth. I don't want you to have your pet's teeth cleaned. I want to prevent tooth and gum disease because it is preventable. Just like you do heartworm prevention, just like you give the different immunizations to prevent them from getting those diseases, just like we do flea prevention. And it's all about preventing problems. Preventing problems is the kind of medicine I like to practice because it's way more rewarding for me, economical for you, and better for your pet if we don't allow something to happen. Now there's plenty of unforeseeable things that can happen in the future. Hit by a car, cancer, broken limbs, those things we can't necessarily plan or count on. But the things we can prevent, that's what we want to prevent because that's the way we can get our pets to be senior citizens and happy and healthy and thriving. Because if the mouth begins to become infected, you're going to have the teeth cleaned. If we don't do something to prevent the infection before getting the teeth cleaned so they don't get an infection, or we don't do something to prevent the infection from coming back after the teeth are cleaned, the infection will come back. So then you end up getting the pet's teeth cleaned once or twice a year. Either they don't survive the dental, or then they get so old we can't do it anymore. And once the mouth falls apart, the pet falls apart, and we usually end up euthanizing them because of the mouth or something related to the mouth. Because the infection of the mouth over time can damage the heart, the liver, the kidneys. You get abscessed teeth, you get suppressed bone marrow. It just takes its toll on them and on our pocketbooks. So it behooves us to prevent as many problems in our pets as we can and shoot to get them into double digits. If they're the breed that can get to double digits. Especially the smaller mammals, the smaller the mammal, whether it's a dog or cat, the quicker the mouth goes south, and the longer they can live. And so our goal is to get our small dogs and cats well into their teens, 15 or 16. Our bigger dogs are shooting for 10 to maybe 12 and praying for 13 or 14. But if we don't take care of their mouths, that is going to be something that's definitely going to shorten their lives and have a huge impact on our wallets. So here's a product that I've used for over 20 years. It's called MaxiGuard. There's Oral Gel and Orazen. They both use the zinc gluconate as the killing agent or the antimicrobial agent. The difference between the two is in flavor. The original formula, you had to activate with a vitamin C. That's what this vial is. You pour this into this container and it activates it. Because of that, it has this kind of tart, sweet tart, bitter kind of a flavor when I taste it. So they came out with a second version, the way of getting around using the vitamin C to activate, so it really has no flavor when I taste it. So I recommend this smaller size for small dogs and cats, the bigger size for bigger dogs. Now you can use the big size in all sizes, and you can use a small one in all sizes, but there is a price difference. The smaller size is more expensive because they found a way around the vitamin C. The bigger size is a better buy because it's twice as much for just a few more dollars. So we try to use the appropriate size for the appropriate size pet. But technically you could use this in dogs and cats of all sizes. The same with this one. But the smaller one I use for the small dogs and cats, this one for the bigger dogs. So the way this works is once this is activated, and we explain all that if you purchase it, is you want to take this stuff, and our pets have these cheek pouches on each side of their cheeks. So you take this product and you stick it in the cheek pouch and you give it a good squirt to fill up the cheek pouch. Same thing on this side. Now how much do you squirt in? Depends on the size of the animal. The bigger the animal, the more you squeeze. The smaller animal, the less it takes. The bottom line is you want to fill up the cheek pouch on both sides. And as you get good at it, you figure out just how much it takes to fill up the cheek pouches. Now if you squirt in each cheek pouch, the second step's even easier. You don't let them eat or drink for 30 minutes. Why? Because we need 30 minutes of contact time. If they eat or drink in that 30-minute window after the application, they're going to wash the medication out. It's not going to work. So you go squirt, squirt, nothing to drink for 30 minutes. Now we got to do this 2 times a day because we only safely kill bacteria for 12 hours. So you're going to do this morning and night their whole life. And if you can start with a mouth that's not infected, it's never going to become infected. If we get a dog or a cat that already has a dental infection, then I have people start this to make this a routine. We get the teeth cleaned as long as they're not too old or it's not too great of a health risk. And then this is what keeps the infection from coming back. Now with the dogs, more so than the cats, after you've applied this medication in each cheek pouch and you waited your 30 minutes, if you'll then follow that with a tartar control chew, and there's various ones out there. Dentasticks have been around forever. There's one called Dentabone. There's one called Checkup. Milkbone even has a version that's shaped like a toothbrush. And they're all under the genre of tartar control chews. And so the way we use these in the dog is you squirt this stuff in each corner of the mouth. You wait your 30 minutes with no food or water. Then you give them a tartar control chew. And you do that 2 times a day. That's the perfect A+ game. Now if they won't chew a dental chew, they're not going to work. And that's why there's a variety of different ones. You got to find ones that your pet will actually like and will chew. If they won't chew these dental chews, then don't waste your money on them. Now they also make a tartar control chew for the cat that comes like a little treat. It's a little mixed bag of crunchy treats. Some cats will eat those, some cats won't. It's worth a try. If they won't eat it, okay, but if they will, it has the same effect. These tartar control chews have a scraping, cleansing action to help scrape off plaque and tartar that's building up on the teeth. This gel will kill off bacteria that causes gingivitis and causes plaque and tartar, will prevent plaque and tartar, but doesn't get rid of existing plaque and tartar. It will soften that plaque and tartar up, allow these dental chews to help knock it off. But the bottom line is we want to catch the mouth before it's infected at all, or at the very least minimal infection. Then we can reverse the effects using these 2 different medications. Or like I said, if the mouth is already infected, then we make this a routine, we get the mouth reset back to a nice healthy mouth, then we don't let it get infected again after that. It can be maintained, it can be prevented. So like I said, our goal is to get our pets to be senior citizens, happy, thriving, healthy senior citizens. And one way to do that is keep the mouth in good shape, because a happy mouth is a happy mammal. So that's one of our many goals for our pets, is to have them be old timers and still feeling good and a big part of the family. So if you take care of the mouth, that's a big part of this journey. Thank you very much.